97.7 The Q and 98 Gold. Stephen Terrell with you here hanging out, and we're excited to welcome back to the program Dr. Lehman from Liberty Clinic. Good morning, sir. How are you?
Good morning. I'm doing great. How are you, Steve?
Good. We appreciate you coming in and sharing different things with us that the Liberty Clinic does. Again, you guys can go to mylibertyclinic.com, and I suggest clicking on services to get an idea of all that you guys do, because it's I don't know if people realize how wide ranging it is that you guys do right here in Rensselaer, right in Jasper County, not having to drive 45 minutes away. It's right here in the Rensselaer Hospital is where the Liberty Clinic is. And today we're going to talk about our skin and the different things that that we deal with, different ways maybe to take care of ourselves, and what to do if we see something or feel something. So where should we start? I'll trust you're the expert.
Skin's the largest organ in your body. You know,
I knew that.
And so what basically we're trying to do here, just educational sort of program for the community, because trying to like elevate the health overall. But we have a lot of farmers in this community, and then other people that have had a lot of sun exposure with their job or otherwise, and that causes skin damage and then can cause all kinds of skin lesions and problems. And so what we do is, my whole goal was to come back home, which is here, and increase access for people. And so providing care so they don't have to leave town, which then not only is giving me the job that I want, right? But it's helping the one-on-one patient, but it's actually elevating our whole community, because it creates all these other basically jobs for other people and downstream positive effects. You know, I don't think that the hospital administrator understands this, who's from Lafayette or Crown Point or whatever, that they don't understand that we don't really want to go to those hospitals. We want to stay here and go to our own
hospital.
Who
wants to drive? Sure. That's when I moved here. I got terrified, because I was like, you got to be kidding. So if I'm having chest pain, I'm going to roll the dice and pray to God that I make it to 50 minutes in the car going 80 miles an hour, you know, down 65. I couldn't believe it. And so the fact that you committed to doing that with your career, going to Mayo Clinic, learning all you can from the top surgeons, teachers, everything, and then bringing that back here so that we don't have to travel that far was, you had me at hello. Like, you know, really.
And it's not a hard sell for me either. It's not like I feel like I'm sacrificing to do that. Like, I'm doing what I want to do, because I wanted to come back. I want to live here, and I moved back to the farm I grew up on, and I just love it. Just like everybody else that's here, because everybody that's here is choosing to live in a place. Like, I understand there's some trade-offs and there's conveniences that you're losing, but I mean, for me, it's definitely worth it to breathe the clean air and go to, you know, the events that we all enjoy and things like that.
Yeah, absolutely. So what's some things that we should know about our skin that we might not realize? I mean, I know it's the largest organ. Okay. When should we consider seeing you? When should we consider making an appointment? When should we go see our GP?
Okay. So you can always go to your GP, but people have issues with access. But you can see us without a referral. I'd like to make a distinction. I'm a general surgeon. People, when I say general surgeon, they're like, oh, so just general surgeon. Okay. You know, and they don't understand. Then I have to say, what is it that you actually do? So to go high level, most common things that I do are belly surgeries and then soft tissue surgeries all throughout the body. So commonly gallbladder, hernia, appendix, anything bowel related, endoscopy, upper and lower scopes, colon, from a cancer perspective, colon cancer, breast cancer, lots of skin cancer, and lumps and bumps sort of all over the body. I mean, we do other things too. And so if you need surgery and you understand sort of what the point of like Liberty Clinic and how we're partnering with the hospital and what we're trying to do here, then you can just ask your doctor if we do it. And you could even go to the website and see, look it up. And if worst case scenario, just call our number at 866-8999. And then we'll be able to tell you if it's something we can do or not. And if we don't, we just coordinate to get you to the right place. But what I want to make a distinction on is that we are not dermatologists. And so there's a medical doctor for every organ, and then there's a surgical doctor for every organ. And so for example, a lung surgeon versus a pulmonologist. Okay. So what we don't do almost never is treat rashes, psoriasis, skin lesions, and not lesions, but skin rashes and problems that need a topical cream or a medicine. That's what a medical doctor does. They write a prescription and then you apply your treatment. We are essentially your surgical team for your skin, and there's almost no surgical problem of the skin that we couldn't handle. So draining an abscess, very common. Removing a skin cyst, very common, like benign skin cysts, moles that may or may not be cancerous or not, and then all types of skin cancer that includes basal cell, squamous cell, up to melanoma. And then you talk about melanoma, that's the scary bad actor. And we can actually do here in Rensselaer sentinel lymph node biopsy, lymphadenectomy, lots of things. We can place your ports. Sometimes people need certain types of injections. We can coordinate with oncology for all those things. So that's the thing that separates us very much from a dermatologist, because they would not be able to, and there's this overlap, which is like a little less than a centimeter skin lesion that the dermatologist might remove, but it's piece of cake for us to remove too. And if it's hard to get in otherwise, then we would be obviously happy to see you.
So can you get into, you had told us a story and I just was like knocked out about melanoma and about the perception here. So can you, I know that kind of makes you a little uncomfortable, but I think like it narrates.
Yeah.
And I think it's an innocent mistake on our part where we don't understand like what you were just talking about until I got breast cancer. When they told me, okay, it's cancer, stage 1, they're like, all right, you need a surgeon. And I was like, well, isn't that you? You're the oncologist. They're like, no, I don't step into this until after you've had the surgeon. Right. So I didn't know how to find a surgeon. You're the surgeon.
Correct.
But I don't think that anybody kind of teaches us that distinction. So I'm really glad you kind of introduced that. And that your whole team of people who we've met over the course of interviewing you has been one polite, kind, instructional, like, and help into helping the deep dive, because we don't know. We're, I'm a broadcaster, so I don't know. You hear that information and you start to swirl, like your brain spins and you don't even know, what do I do next? So it's so good to know that we can do these things here. So please share that story without specific detail, obviously. But
well, one way I like to say to the patients, because after years of talking to the patients, you kind of develop your way of communicating. I like to say, your primary care, insert your primary care doctor's name here, whoever sent them, Dr. So-and-so probably could get your gallbladder out by themselves if they had to. But, they might have seen one in medical school, and they've definitely never done one ever before, but they probably have enough understanding dissecting their cadaver in medical school. They probably could, but it would not be pretty, and it might be fraught with complication and thing. But, similar to that, I probably could treat your medical condition with whatever high blood pressure thing, diabetes plan that you have. And figure out maybe how that medicine interacts with this other medicine, which interacts with this other medicine. Oncology would be a good example. Like I'll tell a patient, the oncologist, they probably could get your colon out, but then they laugh, because it's like, oh, obviously that guy who doesn't do ever colon surgery would not be the guy to have my colon cancer surgery with. Well, similarly, I never, ever prescribe chemotherapy, right? And I never, ever treat high blood pressure or diabetes. So like, and from medical school on right into residency, I'm just doing surgery all the time. And so then I'm the guy that does that. And it's hard for people like think about their primary care doctor and all doctors kind of being like that, but that's not who I am.
Well, I can tell you as a patient, when I got diagnosed, the first thing I said to my doctor, who didn't want to quote refer anybody, she's like, well, there's a phone number, 1-800 call me and they'll tell you who to go to. I said, no, here we go. You've been my doctor for 18 years. Now I'm your sister. Who are you recommending your sister go see to take out the tumor?
Yeah.
And then she responded because I pretty much put her on.
That's a
but
good
that's
way to
what we
advocate
want.
for yourself. Yeah.
I don't want just anybody who can do an accountant spreadsheet to be my accountant. I
Sure.
want the guy who's going to keep me out of prison. If you know what I mean?
Yeah.
So the best of the best, I guess, in that circumstance, which is clearly what you and your entire staff are.
Yeah. Well,
and
we're doing excellent care.
Yeah.
What I don't want to do is put anybody else down. There's been all this other medical, since COVID.
Yeah.
There's been a lot of distrust in the medical community in general, which, Fauci is all, getting blasted and everything by the Senate, and the whole thing's just crazy. But the funny part is that when I was a second year resident at Mayo Clinic, I just remember having this guy that flew in from Abu Dhabi on his private 747 and landed at Rochester International Airport. And he comes in to he's getting his little tiny umbilical hernia fixed by, ironically, me as a second year resident, flying over literally thousands of qualified and capable surgeons who still do that all the time on their way there. Now, it's not like there's unlimited supply of surgeons. But what I'm saying is most people are doing good quality standard work. I am also doing good quality standard work. The main difference that I'm doing is I'm trying to do it here. And so then I'm bringing that, after time goes by, you start to, I think we are doing excellent work, you're not sacrificing anything. But I don't want to be saying, oh, geez, I'm the end all be all. But the story you're talking about, it is a good example of people not really understanding what that is. So I will tell it reluctantly. So I had a patient that came in with a melanoma in situ of her outer arm. And if in situ means that it hasn't invaded, it's not become invasive melanoma yet. And so it's the lowest grade, smallest, no big, it's still melanoma. You're still worried about it for the rest of your life, but basically no big deal melanoma. You take it out with a centimeter margin and you're done. And you don't need to do a sentinel lymph node biopsy. You don't need to do any kind of chemotherapy. You could talk to an oncologist if you want to, but you don't really have to. And so I'm seeing her in clinic. A primary care doctor referred it to me. And I said what the deal was. And my only question was really, honestly, could I just take it out right here in clinic versus do I want to go to the operating room? That's what I'm trying to decide, is scheduling and when and where. And then we get to the end of, I kind of explained things to her. And she said, well, my daughters, they really want me to go to the Melanoma Institute of Indianapolis. All right. Which I had never heard of before. And I don't think that's, it's definitely not
it's a marketing thing.
Yeah, right. And they're not going to do anything. They're going to do the exact same thing, right, as what we do. And I don't do every single melanoma thing here. Like, I'm the gatekeeper who knows when it's appropriate and when what we're doing is, boom, the standard, and when it's not, and when we need to involve somebody else. So, or put you on a clinical trial or things like that. And the ironic part is the person that she's sitting there talking to, me, is the guy who at Mayo Clinic did rotation with Jim Jacob, international leader in melanoma. And we did hyperthermic isolated limb perfusion. Okay, so break that down. What it means is we cut down in the groin on the femoral artery and vein, isolated them, inserted a catheter into each one that would be the same catheter used for heart bypass, hook it up to the actual heart bypass machine, drain all the blood out of the leg, and then run hot chemotherapy through the leg for like 45 minutes or whatever the protocol is. Meanwhile, we're dealing with the primary lesion. We get done with that. We drain all that hot chemotherapy, which we're not allowing to circulate into the body, and we're running at much more toxic doses, and it's just in that one leg at that time. Take that out, repair the artery and vein, close it back up so that it works again, fill it back up with blood, and then do a lymphadenectomy, take all the lymph nodes out of the groin, and then move forward. And we're doing other things like experimental drugs, intralesional injection of Keytruda, and different things like that. That if she knew the person that she's talking to, it's just so silly, the idea. But the thing is, that patient in front of me at that moment, I can't say that to her because it really sounds sort of sales pitchy, you know,
or egoistic,
And
like you're trying to like close her,
yeah.
but she's not. Yeah.
And if you do
Yeah.
that, and then something happens that could happen at the Melanoma Institute, it could happen to me,
Mhm.
like a small thing like a wound infection, hematoma, or even she has the melanoma at some point down the road, then she may think to herself, oh, geez, if I would have done this other thing differently. And so
It's perception.
when that
Mhm.
patient's sitting in front of you, you got to just say, okay, that sounds good. Do that. Just call us if you want. And we don't ever try to like twist anybody's arm to do anything, but it's almost like if people knew what's available, I feel like then they would understand and appreciate it more, and then probably seek us out too,
Right.
Well, I think that's it's kind of the sad thing that your dream, you went to the Mayo Clinic to learn, and you wanted to bring that back here. It's also part of why you do your podcast about rural surgeons. That it's something that I'm sure other rural surgeons face too. It's assumptive that it's small town, and so it's small town doctor, small town thinking, small town like that. You couldn't be a Mayo Clinic expert if you're in a rural area, and I understand that, but that's I think what you're trying to bring here is the understanding that no, you don't have to go to Indianapolis, you don't have to go to Lafayette, you don't have to go to Chicago,
Right, for quality of care
to get taken care of the right way. These are the things that you do day in, day out to help people.
Right. Matter of fact, I
that's
had
what you
my
want.
program director on from Mayo onto my podcast, and we talked about that quality question. And so she actually took it a step further, and I've mentally sort of gotten there, but I don't say it that much. That she thinks that the quality is actually better. And the reason that it's better is it's actually the same quality, but the follow-up and the coordination of care and the family involvement. Like if my family member has to go to an appointment in Lafayette, may or may not be able to make it down there. They have to admit in Lafayette, I may or may not be able to be involved. But when you have family able to come into the hospital for a patient that needs to discharge, come into the appointments, hear from the doctor, especially elderly patients, then you actually get better care because of the after and surrounding care around the surgery. Yeah.
It's so important.
So the crux of this is that you are a surgeon. What that means is you cut. You don't topically ointment things and prescribe like pills per se. You're going to remove or cut out whatever needs to be removed or cut out, or you're going to do the procedure of the endoscopy or the colonoscopies, and then work with the other doctors, like the pulmonary doctors or oncologists, hopefully not, but you will, to make sure that we have the whole approach together.
Yeah.
And we don't have to leave town, so we don't have to drive an hour each way in order to get that quality of care. So
now, if we're unsure, let's say we give you guys a call, okay? 219-866-8999. They call, they talk with you or Taylor, your nurse practitioner, or
most people come in, they see Taylor first. That's how it usually goes, for sake of time, and she has a lot more availability and she knows how to kick things around. Yeah.
But let's say they come to you and what they need is a medical doctor. Yeah. You can then send them that way too, correct?
Yeah, we do.
Like it's okay to start with you if they don't have a GP that's close by and they don't know what this thing is on them, or like in my case, I've got a little lump on my neck,
for a skin lesion. Yes.
Okay.
Like if you just
not a cold,
are like, oh geez, I don't have a doctor. Then don't call us.
No.
Or I ran out of my high blood pressure. Can you refill it? No.
but like you mentioned, you said you're there for surgery, or you said if we need surgery. Yeah. Most of us don't know if we do need surgery.
Right.
We don't know. So we might go to you by accident and find out what you need, you don't need surgery. What you need is something topical.
Yeah.
Hold on.
And
So if you have abdominal pain,
Yeah.
or a lump or bump anywhere on your body that you are worried about, that we would be a great place to start for
Perfect.
those things.
Yeah. Great.
Well, and I would say, moreover, too, you're going to talk to Taylor
Yeah.
instead of an 18-year-old on the 1-800 line
Mhm.
where they schedule something, and then when you get there, you found out you were supposed to have had test results sent beforehand, but how were you supposed to know that? Speaking to
Yeah.
someone local and an actual person who
Yeah.
is educated in what it is you're looking at is everything.
Yeah.
I
Most
think.
of our patients, though, 80% of our patients do come from
From their
their
GP.
primary
Okay.
doctor.
Yeah.
So, but the other thing is, if your doctor is referring you to a surgeon and you know about us in our town, especially, there's now a lot of people that are going out of town for their doctors. And so if there were only 10 doctors in town, or if there were still 10 or 12 primary doctors in town, like there used to be, then they would all know me. But not every doctor in Crown Point, Hobart,
Sure.
Lafayette, Monticello, not all of them know me, and like patients are now going out of town, so then they may have a doctor near them or surgeon near them that they refer to. Well, you can always say, I if you say need to have my gallbladder, I'd like to go to like the Liberty Clinic team in Rensselaer because they're in my town, and then my follow-up can all be close to home. And I want to kind of support my town too,
Mhm.
and help keep my hospital open. And honestly, by choosing to do their surgery in town, that's what people are essentially doing.
Now,
Okay.
can I ask a quick question? And are you also in Monticello or
Yeah.
that area? Aren't you with White
then-
County? Or
So basically, I wanted to come here and be in the hospital that I was born in, which is the Jasper County Hospital,
Mhm.
and be the surgeon. Well, things are different in 2026 than they were in 1988. Okay.
Mhm.
And just hanging up your shingle and being your own person is kind of like, with the way insurance has gone, government intervention in healthcare payer and stuff like that, it's like impossible. So now I have found a model that is working, which is that I'm not an employee of the hospital, but I'm contracted with them, and so I use their infrastructure, and that's working for us. And then after I sort of developed that, which was like 2-3 years ago, I then quickly got too much work that I could handle personally, and then I started building the team. And then after that, 2 other doctors from 2 other towns, would be Williamsport and Monticello, both independently reached out to me and said, "Hey, what you're doing in Rensselaer, could you come also do that here, because we have no surgeon?" So then I said, "Yes, but it's got to be contracted with the hospital in the same way." So then I went to those 2 places, and the hospitals were very interested in doing it. And now we've kind of ramped up at Monticello, which is IU White Memorial Hospital,
Mhm.
and Williamsport, which is Ascension St. Vincent's. And actually, it's really cool, because if I was employed by one of those hospitals, they wouldn't let me go work for like
Got
what
it.
they view as a competitor. But because I have my own independent thing, which is Liberty Clinic, and my team, Dr. Kahn, Taylor, Scott, now we can do that. And then trust builds over time.
Sure.
So basically, I had to, over time, explain, my goal is not to hurt this hospital, it's to build this hospital up. We're going to keep things here that's appropriate. Some patients might have to go out, but it's only when you don't have the right equipment, or
Mhm.
for some reason or other we can't do it. And then we've slowly been able to grow at each location to add more days per week. And it's really been incredibly powerful as a model. And I think that it has the potential to even grow and change rural surgery across the nation, which is part of what I talk about in my
Right,
podcast.
in your podcast.
Yeah, absolutely. Well, you can find out a lot more as well if you go to mylibertyclinic.com or look for Liberty Clinic on Facebook. And if you are dealing with any of the different things, like I said, click on services. You're going to find out the wide array of things that Dr. Lehman and his staff do. So check that out, mylibertyclinic.com. Dr. Lehman, thank you as always.
Thank you, Steve.
We'll take a break and we'll be back in just a little bit.